Diagnostic approaches towards assessment on specific attribute is the premises of today's video. Welcome everyone. We'll understand the approaches thereby and try to understand how do we implement it. What are the best practices in diagnostic approaches thereby? So first and foremost thing are the clinical issues in terms of decision making. So in decision making, what are we looking into it? What are the problem that we are trying to address? Can we figure out certain viewpoints, outcomes, strategies, so that the person with disturbances and their family and the environment, as the case might be. So it should be flexible. It should be an ongoing hypothesis, a personal, emotional behaviors, cognitive functioning, the role of environmental factors, nature, causes, and likely outcomes of the problem thereby. This is what we should always strive to achieve in the first place. Purpose of assessment is the descriptions and the diagnosis that we comes around it. First step is the clinical description, summarizes the person's unique behavior, thoughts, and feelings that come together to make up the features of the person's physiological disorder. As in, what are the manifestation of the cognitive dissonance that a person is doing it in terms of the behavior. So we try to analyze them. We try to diagnose, involves, analyze informations, coming to a conclusion thereby, trying to find out the cause and effect relationship in a concrete fashion. The prognosis or the treatment planning, the formulation of prediction about future behavior under specific condition as the case might be. This is the prognosis, the formulation of the prediction that comes around with the future behavior. Treatment planning and evaluation apply assessment informations to generate a treatment plan and evaluate its effectiveness. And how do we go across with it? The purpose of treatment, the purpose of assessment, why do we go for it? What are the prognosis? What are the formulation that we want to predict? What are the prognosis that the behavior needs to be studied? How do we evaluate the assessment then and there? And that is precisely the assessing disorder is all about in the clinical facility. Now, how do we do it? First and foremost, we need to extract information, collect information from different sources altogether, using a different methodology, and come to the conclusion which is corroborated by different methodology about exactly what is the problem. The method needs to be reliable. It has to be valid, cost effective, and useful for treatment, perhaps. The clinical assessment reveals the person's thought, feeling, behaviors, and the various manifestation that is associated with it. Now, this is what needs to be highlighted and probably most importantly pinpointed. We are talking about the comprehensive assessment, evaluation of person's strengths and weaknesses, thereby, as the case might be talking around here. This is what we should aspire to be. Right. Now, best methodology is the first hand information, and it depends upon the therapist how experienced he or she is, so that the information gathered from an interview methods is actually very precise and useful. So yes, clinical interviews provides a large varieties of information and in a very concise period, includes the developmental or family history. The interview can be unstructured, usually are. It has low reliability and biased information. Did I say the the instructors, or should I the assessors quality of experiences matters the most? Semi-structured interviews are more reliable because it includes specific question and people can come up with it. Now let us understand a different scenarios of an older adolescence or a depression. Just for you, for understanding, I'm just giving it to you. Let's say depressed moods or irritability. The question can be: do you feel sad? Do you feel upset? Do you get moody? Is there a loss of interest? Have you lost interest in doing things? Like your hobbies, is there anything you look forward to? Self deprecatory idea, what is it? Are you are a sense of negativity is creeping around it? Is it true introvert, or is it pessimism in your thought process? Are you feeling worthless? Are you actually striving towards depression or something like that? Have you thought about committing suicide? Do you have trouble sleeping lately? Do you need more sleep than usual? Change in school performances. Do you have trouble concentrating in the schools? Have you ever refused to go to a school, perhaps decrease socialization? Has there been any changes in relationships? The friends, do you feel needs to be alone? Semantic symptoms. Do you get the pains in your stomach? Do you get muscle pains? Anything that comes around it? What are the aches that is been bothering you? And these are the reasons which you need to find out every now and then, and that will help you to ascertain how good things are doing around. So we can it can change from a loss of appetite, loss of energy, loss of application, your mood differences, and sufficiently enough is a good indicator of what exactly is happening. So evaluate person's thought, feelings, behavior in a specific setting. Definitely yes. What we are looking into, the person's thought, feelings, primarily problem of concerns, target behaviors, and factors that control or influence that. The ABC of assessment is all about antecedent. Antecedent is prior to the incident, behavior during the incidents, and consequences. Consequences is post the incident. So we have the ABCs of assessment in terms of assessment, probably in terms of incident, probably in terms of any situation. So what are ABC? Antecedents, behavior, and consequences of behavior thereby. This is what has been meant across with it. So, behavioral assessment, a general approach to organizing using assessment information in the terms of ABCs, identifying a wide range of antecedents and consequences, developing a hypothesis which are most important and or most easily changed as the case might be. This helps you understand, pinpoint what can be done and how it can be improved upon it. Function analysis, let me categorically state in antecedents, which probably maybe, let's say, requesting to go to school, being teased at school, being not good at anything. So if somebody is requested to go to a school, behaviors might be physical complaints, probably there's a headache, there's a stomach ache. Consequences is to stay home. Let's say if you have been teased or abused at the school, so behaviors will be school refusal, absolutely not willing to go to a school. Consequences, because there are no, once you don't reach their school, there are no teasing, there are no abusement. I'm not good at anything, sense of depression, sense of negativity coming in. So this, the behavior, depressive symptoms, probably all staying all by himself or herself, or probably not leaving his or her room, conform to a low self opinion, something that similarly goes around it. Now I'm talking about functional analysis thereby. Behavioral assessment is checklist and rating skills, allows for a person's behavior to be compared with a known reference group, economical to be administered and scored. Lack of agreement between informants is relatively common and is highly informative. The person's behavior checklist, or CBCL, if you want to go around it, what does it tells you to you? It gives clinicians a useful profile of a variety of degrees to the person's problem, how deep the problem is engraved in. It helps the assessor to understand what we are looking into it. So yes, we are trying to compare a person's behavior to the reference point is economical to administer, and probably similar characteristics has been displayed. We are trying to find certain case histories which is similar to it. Parents or other observers record baseline data to provide information about behavior in a real life situation. Recordings may be done. Probably, yes, it might. Post analysis of the recording will give you an data which is easily very accurate. Clinical may set up role plays, simulations to observe person and their families. That is what we all strive to go around with it. Test task given under a standard condition is the purpose to assess how well the cognitive skills of the person is going around it. What is his knowledge level, technical know-how? How well is he comparing his behaviors, his personality with the skill set that he has or she has acquired. A person's scores is compared to the norm group, similar people, similar group. Is it way above the group averages? Is it just about the average of the group? Is it way below the average of the group? Because the group norm may have limitation in terms of race, ethnicity, culture, and various other data points. Psychological testing is all about fairness, context, and development, as the case might be. We are talking about code for fair testing, guidelines which increase clinicians' sensitivity to cultural factor. Test scores should always be interpreted in context. Development tests are used in screening, diagnosing, evaluating infants and young person to identify those at risk as on when on basis. We can also have this cognitive testing or the intelligence testing as it been referred to. It tells you the mental age, the educational qualification, functioning of the person, understanding of the situation or the theory that is prevalent. So it might give a opening to a definition of intelligence that the person possesses around it. Often the physical age and the mental age might differ. So presence, we when we talk about projective testing, is one thing that is being elongated, it been projected, it is being biased to the fact that things might go in a similar fashion. In most of the cases it goes. Present a person with ambiguous stimuli, let's say give them a photographs, and how does he find the interpretation of the photographs? Perhaps does he come up with a bright picture, or does it come up with a not so bright picture, or probably a dull interpretation? A photograph can give out the way the person is thinking around it. The person projects his or her own personality, including unconscious fears, needs, inner conflict, or the ambiguous of the stimuli, as the case might be. Projective tests are the most frequently and most easily identifiable method that has been prevalent of late. Now, talk about the personality testing. Five big factors. One, either you are timid or you are bold. Either you are aggressive or you are not. So you are either agreeable or probably disagreeable. Are you dependable? Probably, or you are not dependable. Are you tensed? Are you relaxed? Are you composed? Are you reflective or unreflective? Are you proactive or reactive? As the case might be, these are the central dimensions of the big five factors: timidness, agreeableness, dependability, tense, and reflective. Every adjective that I've said and the opposite versions to it. So, if we look into it, self reporting personal skill definition: anxiety, yes, feeling of nervousness, worry, fear, attitude towards school, feeling of alienation, not probably able to amalgamate with the teammates, attitude towards the teacher, feeling of resentment, dislike of teachers, the belief that teachers are unfair, uncaring, over demanding. A typicality, the tendency towards bizarre thoughts or other thoughts and behaviors considered odd. Depression, feeling of unhappiness, sadness, dejection. Interpersonal relations, the perceptions of having good social relations and friendship with peers. Locus of control, the belief that rewards and punishment are controlled by external events or people. Relations with the parents, with their families, a positive regards toward parents and a feeling of being esteemed by them. Self-esteem is feeling of self-esteem, self-respect, and self-acceptance, as the case might be. So, what are we trying to attempt? The psychological or neuropsychological assessment is attempt to link brain functioning with the objective measures of a behavior, known to depend on an intact central nervous system. Involves use of comprehensive batteries, assess a full range of psychological functions then and there, as the case might be. Classification and diagnosis. Classification, a system for representing the major categories for dimensions of persons psychopathology, as the case might be. We're trying to understand the DNA of the problem, the classification. If we can classify, if we can identify the problem, diagnose the problem, probably the treatment becomes much more easier. Now, once this has been done, strategies to determine the best plan to give individual. Is it idiographic strategies or nomothetic strategies, as the case might be? Talking about idiographic strategies is person specific. It's related to the person, the situation, whereas nomothetic strategies employs benefit to the information accumulated given on the problem or disorder. So similar kind of people, similar kind of syndrome will have a similar kind of treatments, and that's nomothetic strategies. It's more of problem centric, but idiographic is person centric. In nomothetic, we need to understand the problem and generalize it, and then probably mitigate the problems, mitigate the solution, come up with a solution. Categories of dimension. Categorical classification systems is based primarily and probably on professional expert consensus. A classical pure categorical approach is every diagnosis has a clear underlying cause. So there is a cause and effect relation. Each disorder is fundamentally different from the other disorder. Dimension classification, many independent dimensions exist. It is there in the system. Now, what do we go around it? I'm just trying to give you certain commonly identified dimensions. Let's say anxiousness, depressed, withdrawn, depressed, a social problem. Who is anxious, depressed? Who cries a lot, worries, feels worthless, nervous, tense. Then there are people who are withdrawn, depressed, would rather be alone, refuse to talk, secretive, shy, timid. Then there is people who are socially timid or socially problematic. They are either too dependent, they doesn't get along with peers, gets teased. Now this is commonly identified dimensions for the depression. Let's say look into other things. Let's say somatic symptoms are feeling dizzy, always overtired, or it is paining or headaches. Thought problems, hear things, sees things, strange behaviors, strange ideas, as the case might be. Then we have got aggressive behaviors, which is all about arguments, means to others, attack people, destroy other things, as the case might be. We're talking about attention problem. We're talking about inattentive, can't concentrate, can't sit still, confused, as the case might be. We're talking about rule breaking behavior, lacks guilt, bad companions, lies, run away from the home exactly every now and then. Now, these are rule breaking behavior, these are antisocial behavior. So I am trying to give you the common identified dimensions as on when on basis. The DSM, in the subsequent slides you will come to DSM as a term which signifies diagnostic and statistical manual. So diagnostic and statistical manual, the addition of 5 axes is all about clinical disorder or clinical condition, personality disorder or intellectual disability, general medical conditions, psychosocial and environmental problems, as the case might be, and global assessment of functioning. So, diagnostics and statistical manual. What does it goes about neurodevelopment disorder? Let's say neurodevelopment disorders, people are mentally not at the same age as the physical age is all about it. They might be mild, moderate, severe, profound. Autism spectrum disorder with or without accompanying intellectual or language probability problems, communication disorder, language disorder, speech sounding disorder, childhood onset fluency disorder, stuttering, and so on and so forth. Specific learning disorder with impairment to reading, writing, dyslexia, mathematics, you name it, we have it. We have the attentive deficit or predominantly hyperactive or impulsively predominantly inattentive, predominantly combined presentation. Then we have something called motor disorder, is development disorder, stereotype movement disorder, tourist disorders, and so on and so forth. Fails to capture the complex adaptation, transaction, and setting influences crucial to understanding and treating the person's psychopathology. Give less attention to disorders of infancy, personhood, fails to capture the interrelationships overlap known to exist among many persons hood disorder. What are we looking out here as far as DSM is concerned, the Diagnostic and Statistical Manual? What are the advantages? It first and foremost thing is the diagnostic level helps understands the assessor about what they are looking for and how do the data manifest and what can be the probable solution. Facilitate communication among professionals. Among the peer group of the assessor, they will come to know about conclusion or consensus. Aid parent by providing recognition and understanding the problems of the person. If these were the advantages, the disadvantages were diagnostic labels, wherein disagreement on the label that needs to be achieved as a purpose. Every assessor might have different takes on the diagnostic problems. So that is what becomes a negative impact of stigmatization. About stigmatization is essentially done by the society. People who have half-baked knowledge or half knowledge are not aware of the situation can negatively influence a person's views of themselves and their behavior, as the case might be. Let us look at the treatment aspect. Intervention today are planned by combining almost effective approaches to a particular problem. Prudent problems that we are talking about, prudent approaches that we are talking about, probably approaches that has been ratified, has been successful in the past. The most useful treatment are based on what we know of a particular person and the personhood disorder. Data needs to be shown to see that the intervention works around it. There are multiple problems. And believe me or not, multiple problem will have multiple angles. Multiple angles requires multiple solution. Until and unless for every problem you have two different, three different varieties of solution, you will not be able to pinpoint and focus and assess the treatment altogether. So solving strategies are a part of a spectrum of activities for treatment, for maintenance, for prevention. Interventions are a part of an ongoing decision making approaches, as the case might be. I'm just giving you a sample size about what are the interventions and the settings behind it. Remember, in the center is the youth, as the case might be, the person concerned. This is the person who which comes around here. Yes, youth, the family, the community, and the cultures, and out here would be indicative preventions, time limited therapy, enhanced therapy, continuing care. We are talking about selective preventions, universal preventions, and health promotional positive development. These are the intervention that goes around it. What can be the settings in terms of home, school, neighborhood, primary care center, outpatient mental health center, day treatment center, residential facility, and inpatient facility, as the case might be. So there is a host of interventions and the settings thereby. With this, I come to an end of this presentation. Thank you for watching this video till the very end.